We're gonna take some pictures for you, and if you want to take video, you can too. This is pulse wave Doppler, and then this is color Doppler. It's kind of cool because this will show you where color flow is. You can kind of see pulsating in the baby, in the cord, and the baby circulation.
Oh my gosh.
So,
Oh, thank goodness.
let's see if I can do this focus level down.
Is that the yolk sac up there?
Uh-huh.
Oh, it's so far away now.
Yeah, it kind of, it's on the outside of the amnion, and that's pushing it to the side a little bit. See, it's on the outside of the yolk sac.
So that thing on the top right, is that the where the hematoma was before?
Maybe right there.
Is it looking like it's pretty much healed?
It's not very big anymore. Let's see. I don't even know for sure where it's at because it doesn't. It's gotten so much bigger. See it kicking?
Oh my gosh, what the heck?
Wait, is that legs?
It's a leg right
It's
there.
moving.
What?
And this is a hand right there, and this is the head. We'll make it a little bigger. Let's see if I can do that.
Oh my gosh.
Holy cow, we have a thing that has legs. It has
an
2
alien.
legs.
Whoa, that is insane. Oh my gosh.
I don't know why they couldn't see that. That's kind of weird, isn't it?
Yeah. Yeah, it definitely looked empty. Oh
Take a
my
few still
gosh.
pictures for you.
See, I always thought the head was on the right.
Yeah. Well, do they move? They probably move around.
Well, I can make it on the right if I go like this.
Oh.
So you can do it either way. So this is so. In this picture, this is up toward the head, and this is down toward the feet. So it's kind of sitting upright, kind of, kind of.
Wow. That's so crazy.
So yeah, the heartbeat looks good. I just don't know how to do measurements on this machine. I wish I did, but
Well, it's okay. Let's just at least we know it's still.
I think you got a true sort of novice, a true rookie.
I must.
Because they have a machine that's almost better than this one, not the fetal photo.
Really?
Yeah, they should be able to see pretty easily.
I'll call them back. You need more training.
Well, they shouldn't say you don't have anything in there. Whatever they told you wasn't right.
Yeah, she's like, it just might be too early. I'm like, it's not.
You have to point if your bladder's not full, or if it's too full, then we might not see it too. So.
Huh? Okay.
That's a good point.
Mm-hmm. As far as the
That's so crazy.
as far as the bleed where it was before, I don't know. It's starting to form the placenta, so it's hard to tell that from the bleed, but it looks like placenta now.
What?
See that?
Whoa.
It's all placenta.
When does that take over? Like 12 weeks?
Well, placenta is part of the chorion, which is this layer, and where I don't know where it's attached a little more, where all the vessels are, it's thicker, and it's called the chorion. So.
Oh, okay. What happens to the yolk sac? Does it just die?
We don't know what the yolk sac is. It's like they know there's circulation at first. So we don't know why it forms really.
Huh.
There's really not anything that's part of the. It's coming out through the belly button.
Yeah. So then the placenta, is it? I was just thinking about this the other day. Is it like inside the gestational sac, or is it like a part of it, or is it outside?
So, at the beginning, it forms a sort of a combination of your cells and the baby cells on this chorion, and that's where it bled underneath. And it's kind of like the whole thing is the placenta at first.
Okay.
And then there's a little embryo off the side, and it has the cord that's coming to a certain part that's really vascularized. And So the circulation comes through the cord and then circulates through there and then comes back. So there's a part of it that becomes more part of the baby's circulation on the other side.
Huh.
And so it's the baby's got a little amnion around it, and then there's a yolk sac on the outside of that, and then it's kind of the sac that lines the uterus that becomes part of the placenta is called the chorion.
Wow. That's crazy.
Yeah.
It's really cool.
Did they do genetics on the embryo or anything for you?
We did just like the. Did we do genetic testing? Like just the blood work?
I would have.
I don't think we did. I think
How
we
many
just did
weeks are you
infectious
now?
disease.
12?
9.
Yeah, you have to be 10 weeks to do blood work genetics, but sometimes they'll do a little piece of the embryo and do genetics off a few cells. Or they'll go in early before you have a big enough baby to do an amnio with amniotic fluid, or they look at the blood and they'll take a chunk of the placenta.
Oh.
And look at that, and that will give you an early diagnosis of problems. So.
Okay.
But it's a little dangerous because it can cause. They go in through the cervix to take a little sample.
Oh.
So it's.
Sounds fun.
Yeah, it's a little dangerous.
Yeah. Is that the? Oh no, because the amniocentesis goes through your stomach, right?
Yeah, it goes through here. So they just take a needle and they watch it go into a popping fluid like that.
Okay.
So.
Interesting.
They usually do that around 12 to 14 weeks.
Okay.
So less of a chance for a miscarriage.
God, it looks like me.
Yes. So my mom, when she was pregnant with me, I can't remember what it was called or if it was called anything, but her placenta stopped growing or feeding me.
Placental insufficiency.
Yeah. So I was born like almost 2 months early.
Oh.
So I don't know if that's something that's like hereditary or if it's just random.
It could be. And that would have to do with the chorionic layer would be kind of deficient or not working right.
Okay.
So.
She didn't have it with the other two, so.
But everything looks good. Let's do the pulse wave just to.
It's so cute.
Pretty crazy, isn't it?
Wow, that's so fast.
Wish I could do some measurements for you with this machine, but I just don't know how
That's alright.
to do that.
Still
But
looks
that's-
bigger than last time.
Yeah, I hope you didn't have too many tears today after she told you she couldn't see anything.
My sister-in-law was cute. She's a nurse and she was with me and she's like, "It's okay. Don't freak out. It's okay. Everything's gonna be fine." I was like, "Okay." Try and hold it, keep it strong for her.
Well, that's true. That's like, how did you miss that? Like, was she in a totally wrong spot?
No, she was over there.
Yeah. You can see how maybe if you were just
It looked
looking at
kinda
it
like
like
that.
this, with the crossway, like we usually do, because that's what I'm trying to look at the cross sections. I think eventually you would see the right things. There's the yolk sac. Here's the head in cross section, and the heart's going to be right here in the chest. This is the chest here, right here.
Yeah.
And then there's the legs down here.
That's so crazy.
Focus up a little bit. But yeah, it would. I guess if you're just not paying attention and you're just thinking that you're looking at something else, you wouldn't be able to see it. Because if I'm not looking real careful, I say, well, that's kind of small. You won't see a heartbeat in there unless you're looking really close.
Yeah.
But the usual view we see at about 9 to 10 weeks is this one right like that. So.
Well, I'll tell her to maybe turn the wand the other way. Just kidding.
What is this white line over there? Is that kind of just...
Right here?
Uh-huh.
I don't know. Sometimes I get lost in the and all the other stuff. So it looks like. So this is the bladder right here,
Oh.
Mm-hmm.
and then this is the uterus, and this is kind of on the back side of the uterus right here.
Oh, okay.
I think this is. Sometimes it goes funky right here at the cervix, so that could be. Usually, it'd be weird to see the cervix make that big of a turn and have a retroverted uterus. I think this is just a interface between the bowels back here and the back side of the uterus. If we look,
okay.
if we look here, I can do it better this way. This is a good way to kind of look at things. So this is your pubic bone right there, right?
Mm-hmm.
This is bladder starting. You can sometimes see where the urethra is and where the ureters come in to the bladder. And then there is the vagina, which is kind of flat right here. And then you'll see cervix. This is all cervix right here.
Huh.
And then that opens up to the baby there.
Whoa.
So if you look at it this way, it's a little hard to tell. I think this is all cervix right here. Can't see the vagina real well, but I think this, you're talking about this line right here, right?
Yeah.
I think that line is just where the uterus is making an interface with the bowel right there.
Okay.
So sometimes where you have like a tissue that's different tissue, it'll make a
It's like a little border kind of thing.
This is skin, fatty layers, and this is muscle layer. And then this is your intestines. You'll see them move around sometimes a little bit. When you breathe, they go up and down. Of course, this is the bladder that's full of fluid. So the reason why they make you have a full bladder is because you can kind of see how all the different layers create like a barrier, or at least the ultrasounds can't get through. They all reflect back. So anything that kind of tries to go through it can't go through. So this is all just blurry. You can't see anything. But where the bladder is, it creates a window because the ultrasounds go right through and reflect back really quick because it's like the same
Frequency or whatever?
well, it just doesn't get blocked, so it reflects
Okay.
back really well. It's kind of like you were like in a canyon. You would have it sort of. There wasn't a lot of trees, or like in a room like this, all the sound waves get blocked by things like that. But if they echo off something that's real clear, like a canyon wall, you can hear it better. That's the same way here. So this is an area where it can reflect back through the amniotic fluid. So that's why we can see that pretty well.
That's awesome.
Wow, what cool technology.
So when you have a really super full bladder, and your bladder could get full to fill up this whole screen.
Oh, wow.
Because that's another thing. People go, I need to fill my bladder full. Well, then your uterus is off here. You can't even see it. And I've seen people do that where they think, well, there's nothing there. I can't see the uterus. It's
Yeah.
off the screen. So sometimes a too full bladder can do that. But
Okay. Yeah, when I did the transfer, they made me come with a full bladder. It was so uncomfortable.
yeah, we can usually see it move around a little bit. We saw a little bit of movement. So we can get that other view with the head. And this is the head right here.
That's awesome. So we're looking like down from the head, kind of down towards the feet.
Let's see. Now it's turning there a little bit because now. So this is before we saw it perfect like this, and now we're seeing cross sections that way. So before it had the head up, and now it's sort of the head's down that way. So when I'm looking at it,
I wonder if that happened earlier, and that's why she couldn't find it.
It's a bit harder to see.
Oh, it's moving again.
Yeah, there it is, moving.
Oh my gosh. It kind of looks like it's a guitar or something.
Kind of looks what? Like he's playing the guitar?
It has a guitar. Like it keeps saying like a long thing. So cool.
It's a very look through the bladder. Be able to see what the others. Sometimes can see the feet moving down here.
Oh, it's so cute. Oh my gosh. Wow.
They're doing crunches in there.
Yeah. Working on his muscles. I think I read that their muscles start to form this week or
Yep.
next.
They can definitely move, that's for sure.
That's crazy. Fun.
That's
Oh,
amazing.
thank
I
you
wish
so
I had
much.
more to show you, but that's about all we could really see.
No,
No,
that's
that's
okay.
like-
That was awesome.
That's the most detailed thing I've ever
Yeah,
seen.
it's so cool. Oh my gosh. Thank you so much.
Yeah, thank you.
Hold on to that.
How far along is Jeffrey's leg?